Hi, I'm Dr. Mike Scialabba from 42 North Dental. I'm the Chief Clinical Officer and the Chairman of the Dental Board in the state of Massachusetts. 42 North is a group practice. We are a DSO. We're practices from Maine to Michigan. Mostly our offices are here in the Northeast, New England based. We listen to what the doctors are asking for, and at the same time, it's my job to scout out new technologies to bring to them. And that's one of the relationships that I've been able to bring to them is our relationship with VideaHealth. We're a big believer in technology and aiding our doctors to provide the best care possible to get the best quality outcomes. AI is essential for practitioners because it is unbiased. It doesn't know the color of one's skin, doesn't know the money in their wallet, doesn't know the color of the hair on their head. When I heard it was coming to dentistry, I couldn't wait to implement it into our practices. I wished I practiced full-time with it in my practice because it would make so many conversations so much easier because it gives the patient the ownership that so many of our doctors, or so many doctors in general, are afraid to communicate to the patient that some of this is your responsibility. This is actually here. This is what we see, and we're here to help you. Artificial intelligence provides us the opportunity to identify lesions that we might miss. Our days are busy. We're running from room to room. Depending upon the light in the room, the quality of the monitor, the quality of the x-ray, we may miss a spot. I've missed a spot before. That's the worst thing to ever have to do is call a patient and tell them, oh, by the way, I missed something on your x-ray and that we took a year ago, and now it's bigger. It's happened, it's the worst. So this helps eliminate that. I love the idea that you could apply and take out apply science and taking out the emotion from the doctor in helping them diagnose. And by using AI, you eliminate that and can calibrate a provider based on what is actually fact, not fiction. And as we develop providers in our organization, as we give them opportunities to communicate with patients, I want them talking about facts, not thinking they know what the patients want or could afford. So by taking those things out, you put the opportunity for the patient to make the decision that's best for them, for their potential treatment. What VideaHealth can do is provide a secondary, independent opinion for the patient, and that helps build trust with the doctor. Because at the end of the day, what's most important is that trust between patient and doctor. That relationship is sacred. So what drew me to VideaHealth? The people. You know, I think it's the interaction of wanting to be collaborative about a process to, number one, this is a software that helps. How do we get our doctors to implement this in the practice without it being a top-down dictatorial push to tell them they have to use it? It's basically prove it, show them, tell, show, do, but really show the benefits. Talk about how the insurance is, adjudication of claims is going to be easier. Helping educate our hygienists so they're motivated to talk to patients about bleeding gums and bone loss. The education process, the repetitive process of getting Stephanie, your hygiene coach, into the offices to talk to the teams to basically embrace the technology that I'm so excited about. Everything I talked about, what it can do, where is it going, you guys are delivering. Patients love it. The doctors, once they get used to it, they like it. Initially, there's always resistance from doctors. Getting it through the doctor that they don't have to be like the end all be all, that this is an aid. This is not to punish them. This isn't like that you missed something, you could have had a better, this is to basically help them have those crucial conversations to patients to combine what matters most to the patient, which is a want, and what was needed, and combine the two. The future of AI, I think, is really identifying quality. Insurance companies measure quality. The ADA has a statement on quality. All these other organizations have their quality terms. If you ask a dentist what's quality, they're talking about the tertiary anatomy of a tooth, of an amalgam they did. They're talking about the margin of a crown. At the end of the day, quality is most important to the patient. And the patient determines quality based on, was the doctor nice? Did they have a good relationship? Was it affordable care? And did it hurt? Okay? Was it easy to make an appointment? So how does VideaHealth help with that? VideaHealth helps with that by hopefully building that trust and that relationship, so that if you get a patient who believes that their appointment was a quality appointment because it helped build that relationship, it basically solidifies the fact that the doctor's recommendations are true.